Welcome to the deep dive. Today we're really getting into something quite fascinating, maybe even a bit unsettling.
Mm.
It's all about how the definition of illness seems to be, well, expanding, especially in industrialized nations like Germany, which our source material focuses on quite a bit.
Yeah, we've got some really interesting stuff here, mainly drawing from a book that digs deep into this whole phenomena.
Exactly. And our mission really is to unpack what's driving this expansion, what forces are at play, and, crucially, what does it mean for you, for how you understand your own health?
It's interesting right off the bat, isn't it, how our perception of illness has changed?
How so?
Well, historically, it wasn't seen as this purely biological, universal thing. Disease was, very much tied to society and culture.
Ah, okay. So, like, different cultures might have even had their own specific ailments that others wouldn't recognize?
Precisely. What counted as being sick wasn't just about biology, but about social recognition, about labeling. But the modern view, and this is where things get really complex. It's been massively shaped by, well, big pharma, by medical interest groups.
Okay.
There's this narrative now, you hear a lot, that nature is just brimming with new diseases, always ready to pounce.
Yeah, like we're constantly under threat.
And that only medical intervention can really save us. It's quite a shift from the past.
Definitely. It sets up this constant need for vigilance, for medical solutions.
Which has led to what people call the medicalization of life.
Medicalization of life. Explain that a bit more.
It's this process, often gradual, where normal human stuff, experiences, feelings, parts of aging things that were just considered part of being human, start getting redefined, reclassified as medical problems, things that need treatment.
So life itself becomes a kind of pre-existing condition. It reminds me, actually, of that play mentioned in the sources, Jules Romaine's Knock. From the 1920s.
Ah, yes. Knock, or The Triumph of Medicine. Brilliant piece. It's almost prophetic, really.
What happens in it? For anyone who hasn't heard of it.
So, this doctor, Knock, he arrives in a perfectly healthy village, and through some, let's say, clever persuasion?
Manipulation.
You could say that. He convinces basically everyone that they're actually seriously ill and need his help.
Wow. And the really interesting bit, this play, written a century ago, about a doctor literally inventing patients.
Yeah.
It was a huge hit, ran for ages, adapted countless times, still performed today.
That tells you something, doesn't it?
It really does. It suggests this idea, this theme of turning healthy people into patients. It still resonates. We're still grappling with it.
Absolutely. And the book we're drawing from gives some pretty stark modern examples of this, especially in Germany.
Like what?
Well, take cosmetic surgery. We're talking hundreds of thousands of operations every year on perfectly healthy tissue. The justification often boils down to an unfavorable appearance having, quote, disease value.
Disease value for how someone looks.
Exactly. It shows how societal beauty standards, often pushed by media and industry, get framed as medical issues needing fixing. It blurs the line between just wanting to look different and having a medical flaw.
That's powerful, turning normal variations into problems. What else?
Oh, there are some stranger ones, like paradise depression.
Paradise depression? What on earth is that?
Apparently, it affects retirees living in idyllic places like Majorca. A psychotherapist claims to have seen it people depressed despite living the dream, supposedly.
Huh, okay.
And then there's leisure sickness.
Leisure sickness, you're kidding?
Nope. It's described as this pathological inability to just be idle, to relax, symptoms from fatigue to actual depression, and they claim it affects like 3% of people.
The inability to relax is a disease now.
It seems so. It kind of highlights how our societies value constant activity so much that even needing rest can be seen as pathological.
It really paints this picture where achieving genuine health becomes almost impossible, doesn't it? If even leisure can be a sickness.
And behind all this, there's the money. Let's not forget the financial incentives. The pharmaceutical industry is just booming.
Right.
The book points out, even in 2001, a crisis year economically, the top 10 pharma companies saw profits jump by 18%.
Wow. Recession-proof, seemingly?
Pretty much. And a key reason highlighted is the spending on marketing. It often outweighs what they spend on actual research and development.
So, more money goes into convincing people they need drugs than into finding new cures.
A significant chunk, yeah. A huge part of their budget and workforce is dedicated just to market placement.
Well, that certainly creates a motive, doesn't it? If your business model relies on selling drugs, you need people to feel they need them.
Exactly. And the book argues that exaggerating existing conditions or even, inventing new ones becomes a really potent marketing strategy.
Inventing diseases.
Yeah.
That sounds extreme.
Well, look at the example of social phobia in the company Roche.
Okay, social phobia or social anxiety.
Hmm.
That feels like a real thing for some people.
Oh, absolutely. It can be debilitating. But Roche was trying to promote it as being incredibly common, affecting a huge percentage of the population to boost their drug sales.
Right.
But when it came time for clinical trials, they actually struggled to find enough people who met the criteria.
Really? So the reality didn't match the hype.
It suggested it was much rarer than they were claiming. An industry insider even admitted, apparently, that if you believed all the statistics being pushed, everyone would have about 20 different diseases.
20 diseases. Good grief.
He said a lot of it was just wildly exaggerated, and doctors have raised red flags too, criticizing these epidemiologically dodgy studies that inflate numbers.
Well, might deflate them.
The suggestion is it helps convince people they're not alone, they're in good company, the company of the sick, makes them more likely to seek treatment.
It sounds like a very effective, if cynical, feedback loop.
And it's not just pharma. Device manufacturers, even some medical associations, their business models can rely on this medicalization of everyday
So
problems.
the media plays a part too, you said.
Definitely. Sensational headlines about new killer diseases, miracle cures. The British Medical Journal even called out these mindless medical formulas that mix fear-mongering with hype.
Fear and hope, a powerful combination for selling things. The book uses ADHD as another example, particularly in kids, calling it almost a disease invention.
Yes, it highlights a specific claim about the number of kids needing psychotropic drugs. The source for the claim was murky, but it perfectly suited the interests of the drug companies. And you see companies like Novartis actively marketing these drugs to children, even using things like picture books.
Picture books for psychotropic medication, that's quite something. The book then breaks down how these diseases get invented, right, into 5 main ways.
That's right. The first is basically selling normal life processes as medical issues.
Like what?
Hair loss is the classic example given. Male pattern baldness. A company develops a treatment, and suddenly there's this huge PR campaign, funded by them, of course, talking about how common it is, how it causes panic and emotional difficulties, making it sound like a serious affliction.
Manufacturing the problem to fit the solution they're selling. Okay, what's the second method?
Selling risks as if they are diseases. Osteoporosis is a prime example.
How so?
Well, bone loss happens naturally as we age, but pharma companies sponsored meetings where this normal age-related bone loss was effectively redefined as a disease needing treatment.
Shifting the definition.
Exactly. And they do this with other things too, like lowering the normal thresholds for blood pressure or cholesterol. Instantly, millions more people fall into the at-risk or sick category.
Redrawing the boundaries of health. And genetics plays into this now, too.
Big time. The book suggests the decoding of the human genome is turbocharging this trend. Now, you can find defective genes in perfectly healthy people and label them as not yet sick. It creates a whole new frontier for preventative medicine, whether it's truly needed or not.
So even your genes can make you a patient, even if you feel fine. Were there other specific methods mentioned?
The source didn't list out 5 distinct numbered points beyond those first 2 examples, but the overall pattern is clear. Framing normal variations, life stages, or risk factors as medical conditions requiring intervention.
Got it. And the financial side of this medicalization trend is, well, enormous.
Absolutely huge. Once an illness, even a newly defined one, gains acceptance, people and insurers start paying for treatments. And the book argues that healthcare reforms haven't really tackled this issue of disease creation.
Leading to what?
To what the source calls a kind of legally sanctioned exploitation of social insurance systems and, well, gullible individuals paying out of pocket.
And in systems like Germany's, with solidarity funding, everyone pays for these potentially inflated costs.
That's the point. Everyone chips in, so the cost of treating potentially unnecessary conditions gets spread across the entire population. The book cited some pretty stark figures from 2001 showing rising costs per person and as a share of GDP.
So it's not just about defining new diseases, it's also about medicine reaching further into everyday life.
Yes, exactly. There was even a proposal mentioned for GPs to do house calls on healthy people, specifically to look for health risks.
House calls on healthy people, that sounds intense.
Yeah.
What would they be looking for?
Well, one proponent suggested looking for signs of loneliness or potential alcohol issues, maybe depression, by checking things like How many bottles of a certain herbal tonic someone had in their cabinet.
Seriously, your medicine cabinet becomes evidence against you, even if you feel fine. It really does sound like Dr. Knock all over again.
It's uncanny, isn't it? A Swiss medical journal even apparently suggested doctors could learn from Knock's strategy of turning healthy people into paying patients, calling it a win-win for the entrepreneurial doctor.
A win-win. That's a
Ah.
perspective. And celebrities get pulled into this too, promoting awareness.
Oh, yeah. Pele's campaign for Pfizer on erectile dysfunction is a key example.
Kele, the football legend.
The very same. Promoting awareness for ED despite, by his own account, not suffering from it himself. The ads didn't even mention Viagra directly, apparently.
Ah, subtle. Destigmatize the condition, make it seem common, create demand.
Exactly. And the book mentions these questionnaires, too, designed to diagnose relationship disorders.
Relationship disorders. What kind of questions?
Things like, are you worried about your partnership? Has your appetite changed? Do you have trouble sleeping? Is your interest in sex lower? Very broad stuff.
Stuff that could apply to almost anyone at some point in a relationship. Easily pathologized.
Precisely. Casting a wide net. Now, shifting focus a bit, let's talk about the direct influence of the industry on doctors themselves.
Okay. How does that work?
Well, first, the sheer number of sales reps is just staggering. One company, GlaxoSmithKline, had 17,000 in Europe and the U.S. alone back then. The total number in the U.S. more than doubled in just 5 years.
That's a lot of people trying to influence prescriptions.
A huge amount of pressure. It even got to the point where companies were effectively paying doctors for 10-minute meetings with reps.
Paying doctors for their time. That sounds ethically murky.
Yeah, the book mentions a service facilitating this, a fee for a short meeting. And the line between marketing and, well, illegal incentives can get blurry. Think gas and go meetings where reps pay for gas, or investigations into alleged bribes involving travel and gifts.
So, a system potentially rife with conflicts of interest. Does this influence extend to treatment guidelines?
Oh, absolutely. If a company's drug gets into the official guidelines, that's gold.
Right. Instant credibility, more prescriptions.
Exactly. And one study found almost half the authors of major guidelines didn't disclose their industry ties when asked, which is concerning.
Understatement. That silence is deafening. And doctors themselves can become paid mouthpieces.
Yeah, opinion leader management, it's called. Professors, top doctors paid significant fees to speak at company press conferences.
Do they control what's said?
Often, yes. Through things like slide reviews, where the company vets the presentation. Interestingly, the book notes that doctors who are more critical of the industry were less likely to take this money.
Suggests a potential bias in who becomes an opinion leader. What about the medical studies themselves? The supposed bedrock of evidence.
The book calls medical journals the hardest currency of disease mongers.
Wow. Strong words.
Research shows that studies sponsored by industry are far more likely to find positive results for the sponsor's product. It makes sense, but it's worrying.
How does that happen?
Examples include delaying publishing negative results, secretly commissioning counter reports, even allegedly threatening researchers who find problems.
That's incredibly serious, undermining the whole scientific process. What about seeding trials?
That's another tactic. Basically, paying doctors to prescribe a new drug to patients under the banner of a study, even after the real research is done.
So it's not really research, it's familiarizing doctors with the drug, getting them used to prescribing it.
Pretty much. It's marketing disguised as research. And then there's the direct advertising to consumers, which is huge in places like the U.S.
Right. Asking your doctor about the drug you saw on TV.
Exactly. Creating demand from the bottom up. Companies even partner with patient self-help groups. And the possibility of selling prescription drugs directly online could bypass doctors even more in the future.
So patients are being directly targeted. And celebrities are used here too, right? Not just for general awareness.
Yes, there's a whole niche PR industry connecting celebrities, often discreetly, with pharma companies to promote awareness for specific, sometimes obscure conditions, usually for a nice fee.
Lending their fame and credibility. Does all this advertising actually work? Does it drive people to the doctor?
Apparently, yes. One U.S. survey found about 20% of adults had gone to their doctor specifically because of a drug ad they saw.
20%. That's significant. And the media you mentioned are often allies in this.
The industry cultivates that relationship, sponsoring seminars for journalists, sending out floods of press releases, covering travel costs for conferences.
Shaping the narrative. Has the quality of medical reporting been looked at?
Yes, a Harvard study analyzed media coverage of 3 drugs. The findings weren't great.
Oh.
A huge chunk of articles didn't even mention effectiveness data. Most used relative benefits, which can sound more impressive than absolute benefits. Over half didn't mention side effects, and most failed to disclose the experts' financial ties to the drug companies.
So the public isn't getting the full picture, often.
It seems not. The study even recommended education programs for journalists, and the industry is literally taking medicine on the road now, too.
That I mean,
Mobile units like an osteoporosis mobile or a Pfizer truck going out to find patients. The book calls it actively hunting for patients, setting risk thresholds so low that almost everyone qualifies as having something wrong.
it feels like an ever-widening net.
Mm.
And the more things we measure.
The fewer people are considered perfectly healthy. It leads to that cynical doctor saying, a healthy person is just someone who hasn't been investigated enough.
A chilling thought. And the thresholds themselves, like for cholesterol, seem arbitrary.
The German example is stark. A private group of professors with industry ties set cholesterol thresholds that labeled most Germans as abnormal, even though a major study showed average levels were higher. Millions became risk patients overnight, despite feeling fine.
So the diagnosis itself becomes the disease, as Karl Kraus said. It really shows how definitions can be manipulated. Medical imaging, too, while revolutionary, has downsides.
Absolutely. CT scans, MRIs, amazing tools. But now you see whole body scans marketed to healthy people, sometimes even in shopping malls.
Really?
Yeah. Despite medical bodies like the American College of Radiology advising against it for asymptomatic people, these scans often find tiny, irrelevant abnormalities.
Which causes what? Anxiety, unnecessary follow-ups,
Oh.
costs.
All of the above. And potentially a false sense of security if nothing major is found. Plus, there's the push towards using brain scans to spot early signs of mental illness.
So even if you feel fine, a scan might label you pre-mentally ill. It seems even the act of diagnosis itself can be problematic.
Diagnoses are necessary, of course, for treating real illness, but the book points out people often get assigned diagnoses just for insurance paperwork, even if they came in feeling well. Many diagnoses are just based on symptoms, quite speculative, hidden behind complex Latin or Greek terms.
And sometimes, normal physical variations get blamed for unrelated complaints.
Exactly. Minor spine changes seen on an X-ray, an incidental kidney cyst. These might get blamed for back pain or anxiety when there's no real connection. This leads to the idea of non-diseases.
Non-diseases, conditions that are basically invented or exaggerated.
That's the concept. While official bodies might deny it, many doctors struggle with these new, vaguely defined conditions. The BMJ even surveyed doctors to identify the top 20 common non-diseases.
Have we seen this kind of thing before, historically?
Oh, yes. Surgical fads that came and went. Like the mass removal of tonsils and adenoids in kids' early last century examinations showed fewer and fewer kids deemed healthy the more they were checked. The list of alleged diseases just keeps growing, 40,000 conditions recognized, apparently, with new ones like shopping bulimia proposed all the time.
It's relentless.
Yeah,
And medicalizing risk factors is key to this expansion.
definitely. High blood pressure, high cholesterol, systematically presented as diseases in themselves by industry-backed groups, using those arbitrary thresholds we talked about, often focusing on things easy to measure, like blood pressure and cholesterol, rather than a holistic view.
Convenience over complexity. And the screening recommendations get younger and younger.
The American Heart Association suggesting cholesterol checks for 5-year-olds is one example. But interestingly, many doctors doubt the whole cholesterol theory of heart disease is as solid as we're led to believe.
Really, the link isn't that clear.
Experts quoted in the source express serious doubts. Lack of controlled studies proving that lowering cholesterol actually saves lives in the general population. Some studies even suggesting the opposite. There's talk of public brainwashing into believing lower is always better. The original research underpinning the theory has also been criticized.
But what about those rare genetic conditions with super high cholesterol?
That's different. Familial hypercholesterolemia that does strongly correlate with heart attacks, but the mechanism might even be different from typical atherosclerosis, as deposits are found everywhere. The relevance for the average person's cholesterol level is much more debatable, and aggressive low-cholesterol diets can even be harmful for frail elderly people.
Yet, the drugs, the statins, are unbelievably successful financially.
Blockbusters, billions in sales. But the absolute benefit for preventing a first heart attack is often quite small, meaning you have to treat a huge number of people for a long time to prevent just one event at massive cost. Intriguingly, some big studies found statins helped even people with low cholesterol.
Suggesting they do something else, maybe reducing inflammation.
That's one theory. which, ironically, makes the cholesterol level itself less important for deciding treatment, some experts say. Treat the overall risk, not the cholesterol number.
Interesting. Blood pressure measurement is another huge area.
Right. The most common procedure, apparently, and the biggest trigger for long-term treatment in otherwise healthy people, even though blood pressure naturally fluctuates a lot.
Okay, let's talk about osteoporosis again, medicalizing normal bone loss and aging.
Exactly. It's natural, often doesn't cause major problems. But giving it the name osteoporosis, brittle bones, and marketing estrogen heavily for menopause framed it as a widespread disease needing prevention and treatment. Calcium supplement sales went through the roof.
And the definition itself got broadened.
Hugely. In 1993, a WHO redefinition, sponsored by pharma, included gradual loss of bone mass with age. They compared bone density to a young person's peak density.
So older people automatically score lower.
Of course. Then they set arbitrary cutoffs. Suddenly, millions more women, especially older women without fractures, had osteoporosis or its precursor, osteopenia. It fueled a massive industry around bone density testing and treatment pushed by the bone lobby.
Normal aging redefined as disease. It fits the pattern. The book called Health 100% Metabolic Disease.
Yeah, because researchers have identified something like 300 risk factors for heart disease alone. It leads to these absurd satirical descriptions of someone with supposedly zero risk, highlighting how impossible the standard of perfect health has become.
Statistically impossible to be healthy. This medicalization affects women's health very specifically too, doesn't it? Let's dig into that.
Right. Historically, women's bodies, particularly reproductive organs, were often seen as inherently prone to illness, leading to some pretty drastic treatments in the past.
Yeah.
And modern gynecology, the source argues, has kind of continued this by framing natural life phases, puberty, pregnancy, menopause, as potential medical problems needing management. The definition of normal keeps shifting towards pathological.
Even starting periods and adolescence.
There's encouragement for girls to see a gynecologist very early, establishing that medical relationship young. Pharma companies support things like special teen consultation hours and distribute magazines in waiting rooms, positioning the gynecologist as a lifelong health partner.
And interventions like hysterectomies. Are they always necessary?
They're incredibly common, but experts estimate a huge percentage, maybe 60,000 a year in Germany alone, are medically unnecessary. Often done for quality of life reasons, not life-threatening conditions, and studies find many removed uteruses are perfectly healthy. Training requirements and cultural approaches also seem to influence the rates.
Pregnancy, too, has become a risk situation for many.
The list of risk factors just keeps growing, which ramps up anxiety and potentially leads to more interventions. It's interesting to compare with places like Scandinavia or the Netherlands, where midwifery is more central, risk categorization is lower, interventions are fewer for normal birth, but outcomes are just as good.
And C-sections are on the rise too, sometimes by choice.
Elective C-sections, or wish sectios, are increasing, driven by convenience, fear of childbirth, lifestyle factors. It's a big shift from when C-sections were rare and dangerous, adds significant cost to the system too.
And menopause, another natural stage, heavily medicalized.
Hugely. From early 20th century ideas of it being a disease to the mass promotion of hormone replacement therapy, HRT, initially with estrogen like Premarin.
Right, HRT became almost standard for a while.
Recommended for most women over 50 in the 60s, concerns about uterine cancer led to combined estrogen-progesterone therapies, but then later studies linked those to increased breast cancer risk.
A real roller coaster of recommendations.
Despite the risks emerging, there were efforts to reassure women, even claiming HRT reduced heart disease and cancer mortality claims later contradicted by large studies. Menopause was reframed from just a transition phase to being a risk factor for disease, justifying lifelong hormone use. But major studies ultimately found little to no benefit for overall well-being or mood from combined HRT.
Medicalizing aging, treating it, then treating the side effects. It seems men aren't immune either. The male menopause.
Ah, yes, andropause. Companies worked hard to promote this idea, declining testosterone in aging men as a widespread deficiency needing treatment. Launching testosterone gels, funding research, using PR firms, engaging professors.
To pathologize something previously seen as normal aging.
Exactly, creating multiple names for it. Aging male syndrome, andropause, PEDAM. Many endocrinologists were, and are, skeptical, seeing it as just pathologizing getting older. The number of men with genuine deficiency is small, but the potential market of aging men is huge.
So the marketing focuses on anti-aging, wellness.
Pretty much, encouraging off-label use even when levels are normal, despite potential risks, like promoting prostate cancer, which some studies, even the manufacturer's own, hinted at. Research even questions if andropause as a distinct syndrome actually exists.
Interesting. And related to that, sex itself is increasingly medicalized.
Viagra was the game changer there. Suddenly, erectile function wasn't just part of life, it was a medical need addressable with a pill. Huge market success.
Triggering a wave of similar drugs for men.
Dozens of them. And it shifted norms, too. Regular sex portrayed as vital for health, potentially medicalizing abstinence or lower libido. Then came the push for a female Viagra, defining female sexual dysfunction and claiming it affects nearly half of women. Though reported rates of dysfunction often seem inflated in marketing compared to other surveys.
And the marketing targets younger men too now, more lifestyle use.
Seems that way. And these drugs are increasingly available online, often bypassing a doctor visit. The market keeps growing, putting pressure on insurers to cover costs, sometimes successfully based on arguments about sexual activity being a basic human need.
From aging to sex, normal life functions reframed as medical territory. What about genetics? The final frontier of medicalization.
It certainly looks that way. Direct-to-consumer genetic tests promising risk assessments for all sorts of conditions, sometimes sold alongside cosmetics, raising ethical questions.
How reliable are these tests?
Experts have major concerns about their validity and interpretation. So-called bad gene variants are actually very common, meaning most people will have several flaws according to these tests. Predicting complex diseases from genes alone is incredibly difficult because environment and lifestyle matter so much.
Potential for false positives, needless anxiety.
Huge potential. And genes can lie, having the gene doesn't guarantee the disease. The worry is that sequencing the genome will medicalize thousands of tiny genetic variations, labeling healthy people not yet sick.
Premature medicalization.
That's the term used. Applying the disease label before we even know if prevention or treatment is useful. It risks genetic discrimination by insurers or employers, despite some voluntary agreements trying to limit that. Cases have already occurred in the U.S.
And the psychological impact. Knowing you have a supposed genetic flaw.
Could create huge anxiety, undermine well-being, creating this group of the healthy sick. Screening for things like hemochromatosis illustrates it. The genetic risk is found far more often than the actual disease develops, turning healthy people into worried patients.
And the cost implications if we start treating all these asymptomatic genetic risks.
Potentially astronomical. Plus, the resurgence of eugenic ideas through embryo screening and selecting for good genes. It's a minefield.
It paints a future where we might feel sicker than ever, despite medical progress. This brings us to the paradoxes the book highlights. First, costs exploding without health improving proportionally.
Exactly. This comprehensive medicalization is a huge driver of unsustainable healthcare costs. Spending keeps rising. A huge workforce depends on people being sick or feeling sick. Trying to implement widespread preventative treatments for everyone deemed at risk would be unaffordable. Resources spent on questionable treatments could be used for serious illness or basic health in poorer nations.
Paradox 2. More knowledge leads to more perceived illness.
It seems counterintuitive, but yeah, increased awareness of diseases, risks, treatments might actually make people feel less healthy, more worried. More information doesn't automatically equal better health perception.
And the third paradox. Healthy people worrying themselves sick.
Also counterintuitive. Wealthier countries with better healthcare often have populations reporting poorer health. Amartya Sen's work in India showed higher literacy and healthcare access correlated with worse self-rated health compared to areas with less access.
Why would that be?
Perhaps preoccupation with minor issues, heightened awareness of what could go wrong is a luxury of societies where basic survival isn't the main concern. Maybe, in a way, less medicine could lead to a greater sense of well-being for some.
And medicine itself can cause sickness, right?
Definitely. Unnecessary treatments have side effects, create dependency. Medical errors are a major problem, and the sheer number of drugs available far beyond essentials increases the risk of adverse reactions, which cause a significant number of deaths.
Beyond just avoiding sickness, there's the push to be more than healthy.
Right. Cosmetic medicine booming, people wanting prophylactic surgeries, using neuroenhancers, dissatisfaction fueled by societal pressures around aging, beauty, fitness potentially linked to body dysmorphic disorder, and marketing of lifestyle drugs for hair, potency, weight, even botulinophilia wanting Botox even without excessive sweating.
But amidst all this focus on individual health and optimization, socioeconomic status remains key.
Absolutely. The link between income and health is undeniable. Lower income groups face significantly higher risks for many major diseases. It's not just lifestyle. Chronic stress, lack of control, the effort-reward balance seem to play a huge biochemical role. But medicine often overlooks these social determinants.
And for many, the endpoint is still the hospital.
The trend is dying in hospital, often elderly, with multiple conditions, undergoing rapid diagnostic tests right up to the end, maybe prioritizing investigation over comfort.
So what's the way forward? The book offers suggestions.
It calls for things like greater independence for doctors and researchers from industry money, stricter marketing regulations, public health campaigns promoting realistic views of health, funding for independent research on long-term drug effects. Essentially, stepping back and critically evaluating this relentless expansion.
Okay, so summing up this deep dive. It's clear the definition of illness is expanding, driven by a mix of genuine progress, but also powerful commercial interests, marketing, and shifting cultural ideas about health.
Right. And this has huge financial consequences, but also personal ones, turning normal life experiences into medical problems, potentially creating more anxiety and unnecessary treatments than actual benefit.
So for you listening, it's worth considering how this affects your view of your own health. When you hear about a new condition or a risk factor, where might the line be between genuine concern and, well, medicalization? Are parts of your own life being framed as medical issues when maybe they're just life?
And that leads to the final thought. In this complex landscape with all these pressures, how do you navigate it? How do you maintain a balanced view of health and well-being for yourself? And maybe the biggest question, when should we collectively push back and question this ever-expanding definition of illness?